This presentation is on the supplementation of medium chain triglycerides, also known as MCTs, by Brianna Boyd, Kara Pohlmeyer, and Kelly Rice. Medium chain triglycerides, also known as MCTs, are available in multiple different forms. These forms include drops, soft gels, capsules, packets, and scoops. For the purpose of this presentation, we will be focusing on the liquid soft gel form of MCTs. In healthy individuals, single doses of MCTs have been stated to reduce blood triglyceride levels as well as increase metabolic rate and energy expenditure, along with an increase in feeling of fullness. Collectively, these allow the individual a better chance to decrease their body fat. Looking at MCT supplementation from a physiological standpoint, it is plausible that MCTs could increase metabolic rate, increase the energy expenditure, and as a result, decrease body fat in individuals.
There is not a clear definition of exactly how much MCT should be consumed. In relation to the soft gel, it is suggested that 1 tablet be taken 3 times per day. Throughout the literature, total consumption ranges vary anywhere from 30 to 60 milligrams per day as a recommendation. Fortunately, MCTs are not a harmful supplement since they are naturally consumed on a daily basis through foods such as butter and milk. The upper limit of MCTs is the same as the recommended amount of fat in someone's diet. This should be about 20 to 35% of total caloric intake, or 1 gram per kilogram daily. With regulation, MCT should not cause a positive test result on an NCA drug test. However, just like almost any supplement, a high amount of any substance may be cause for concern. The potential benefit of MCTs is having a larger supply of easily accessible energy. The advantage of MCTs are that they are a fat that has the ability to be used as quickly as glucose, therefore allowing for longer and more effective endurance training sessions.
MCT supplementation has become a hot topic in the endurance training setting due to the idea that it can be used as a more readily available form of energy for long endurance training. Although this is a common belief, there is a lack of human studies that can prove that the supplementation of MCTs is effective or can offer improvement in endurance training duration or intensity. One of the few studies completed with human subjects was done at the University of San Diego. This study was designed to assess the effects of chronic consumption of MCTs on endurance running performance. The study took 12 well-trained endurance runners around the age of 30 and had them consume either 56 grams of corn oil or 60 grams of MCT daily for 2 weeks. Each athlete took both supplements, separated by a 2-week cleanse. During each phase, they were told to keep a low-fat diet and to train as they would normally. At the beginning of the trial, VO2 max measures were taken at different percentages. Blood measures were also taken. At the end of these trials, these same measures were taken. The researchers predicted that the results would improve during the MCT supplementation phase. At the end of this trial, their hypothesis was proven wrong. There was no significant changes in any of the measures taken during either trial, further stating the claim that MCT supplementation has little effect on exercise performance. These subjects did report gastrointestinal discomfort during the MCT phase, which has been commonly reported in most studies using MCT. These findings are also consistent with our sport nutrition textbook, which states several studies of well-trained endurance athletes have found that MCT ingestion does not alter fat metabolism, spare muscle glycogen, or improve performance.
All of the evidence collected from the literature on MCTs leads us to one conclusion. While it may be considered to be a safe supplement when used in regulation, the supplementation of MCT has had no proven effect on fat metabolism, energy storage, energy usage, or endurance performance. Therefore, it is not a necessary supplement for the endurance athlete.